Hi, this is Lucy Sullivan interviewing George Clem on May 30th, 2012. George, when and where did you receive your credentials, and where do you currently work?
Well, I'm currently retired, and I received my credentials. I took the examination at the University of Michigan in Ann Arbor in 1967, and at that time I was working at the Cleveland Clinic with Dr. Charles Henry.
What drew you to EEG and neurodiagnostics?
I'm sorry, Lucy, I didn't understand the question.
What drew you to EEG? Why did you become an EEG tech?
Right. I was working in a local hospital in the emergency room and as a respiratory technician, essentially pushing around oxygen tanks. And the head of the department was in charge of the division of medicine, and he was interested in starting EEG as a laboratory at our hospital. He interviewed me for the position, and I interviewed with a staff neurologist, and I agreed to then accept a training period. And I took a training period I agreed to 6 months of training at the Cleveland Clinic, and but I had to be accepted by their clinical EEGer, who at that time was a neurologist by the name of Nelson Richards, and he agreed to train me, and I agreed then to work for the local hospital for a period of at least 5 years, since they were going to pay me for the 6 months of training.
Was EEG a popular specialty when you were starting your career?
It really wasn't. I don't think there were very many people that knew anything about EEG, except a few of the neurologists who were all trained at the Cleveland Clinic. And the neurologists were essentially 3-month trained EEGers at that time. So it wasn't a very popular field, and I suppose in the state of Ohio there were maybe 30 laboratories that had EEG.
Who were your early mentors?
Hold on a minute.
Okay.
The early mentors that I had were the local neurologist, whose name was William Duig. The neurologist at the clinic was Nelson Richards, and the head of the neurology department was Dr. Guy Williams. Other than that, once Dr. Henry joined the clinic, he was my mentor, and through him I was mentored by Dr. John Osselton, Dr. Bill Irwin, Albert and Ellen Grass, and then finally Dr. Luters, Hans Otto Luters.
What were your earliest career influences?
Well, I was interviewed with Dr. Henry for a position about taking the ABRET examination, and he, after talking to me for a long period of time, decided I probably shouldn't take that exam, that I wasn't qualified at that time. And he advised me to read several reference books, which he lent to me, and after I reviewed some of that material and I came back to him and we spent a lot of time together, he interviewed me for a position there at the clinic, and I took the position, and in about 2 years later I became the chief technician at the clinic. Dr. Henry introduced me to many international EEGers, and he was instrumental in getting me involved in the asset, and I became active in teaching at the local level and also at national meetings.
If you had not become an EEG technologist, what would you have liked to have done?
I don't know what I would have done. I probably would have stayed on as a respiratory tech, and maybe gone on and become registered as a technician in that area. I don't know that I would have had the influences around me like I had in EEG, and I probably would have not progressed at the level that I have in EEG.
Why do you think EEG took off when and how it did?
It took off basically because of the original 10 technicians who were involved through ASSET and the formation of ASSET and the development of education and training programs. These were the same group that took the first ABRET examination and included many people like Lila Snodgrass, Dita Sinnott, Lowry, and Nina Kagawa, Dorothea Brittenham, just to name a few of them.
What kind of equipment did you train on, and what were the main limitations of it?
I trained on a Grass Model 3 8-channel EEG machine and a Grass Model 4 12-channel machine. These were vacuum tube instruments, and they had wet cell batteries on them that had to be charged nightly and over the weekends to be sure that they were properly charged in order to regulate the power supplies to the vacuum tubes that were there. The main limitations were the vacuum tubes were unstable, and they had to be tested and balanced out for stability. They came in pairs on the amplifiers. They were hot, and you had to have cooling in the laboratory to keep the machines cooled down. Otherwise, they would overheat, and then the baselines would be all over the place. The number of channels that we had was also a limitation, since you couldn't examine the entire head of electrodes at the same time. And so montage derivations were also limited then.
What other equipment have you used over the years, and what are the pros and cons of them?
I recorded with Beckman, Hoffner equipment, SLE equipment from England, Nicolay, Neon Coden. These were all ink writing instruments, and I've also used computerized equipment from some of the same companies, and also some of we had a homemade computerized system at the Cleveland Clinic, which we developed there, and we bought amplifiers from various instrument companies to use for amplifying the EEG. Some of the systems allowed us to record up to 128 channels per patient. Of all the equipment that we used, though, I would say that none of them held up in stability and reliability like the Grass machines did. They were really a workhorse of equipment for us.
What memories do you have of your training?
The technician trainers were excellent in dealing with the patients and basic understanding of clinical EEG. They couldn't look at an EEG and tell whether it was normal or abnormal based on age and so on. But they had very limited technical knowledge. They weren't technically oriented ladies, and they didn't understand how technology was important in helping to ensure that the EEGs were done properly. There was a poor understanding of polarity and instrumentation, and they didn't seem to have an interest in reading this kind of equipment, which was referred to me by the EEGers there. One of my favorite books for learning about EEG was Electroencephalography by an English writers, Hill and Parr. This was a book from England, and there weren't many books written by Americans at that time, except for the Gibbs Atlases, which had limited instrumentation. Some of the instrumentation I learned was from the manuals and so on from the instrument companies. The technicians there, though, didn't seem to have an interest in reading that sort of information and gaining it.
What are the main ways in which the field has changed over your career?
Changes were due to the organization of ASSET and the education and training programs that they developed, clinical courses that were taught. And there was also a strong collaboration between these original group of technologists who helped to form ASSET and the EEG exam boards, and the collaboration was between them and the EEGers that they worked for. This was a very special group of EEGers who promoted the technicians that worked for them and helped to educate them along the way. And I think without them, it would have been a long, long time before EEG would have come along the way it has.
How has scientific knowledge changed the field, and what do you think were the big breakthroughs?
The biggest breakthroughs probably were in the treatment of epilepsies and through medication improvements that came about. And the classification of the epilepsies was instrumental in the advances of EEG, since EEG then helped in the diagnosis of some of the various epilepsies. The use of EEG in the determination of brain death was probably instrumental in doing that time, because there was no other real way of examining the brain to determine brain death. Training and education of both the technologists and the physicians through formal training programs, the certification of technologists and EEGers. Physicians were required to have more than on-the-job training during a 3-month period of their neurology residency, and the acquisition of epilepsy surgery programs was a big help in doing that, because it required more and more well-trained people.
What are the 2 to 3 big issues in EEG that people are working on to solve today?
I think they're working on advances in equipment and the electrodes used interoperatively for the surgery of epilepsy, the monitoring of ICU patients for a variety of reasons, and the advancement of or recognition of various childhood neurological diseases and their treatments using EEG technology.
What are the main areas of professional discussion or disagreement today?
I'm really not sure what to put in that group, because I've been retired now for 10 years and I'm not actively involved in any of that information. But from what I see, it's still a discussion of how EEG is useful in the diagnosis of a variety of neurological and childhood diseases.
What are you most proud of in your professional life?
I was proud that I was able to educate myself and others in the field. I believe that I was instrumental in training over 200 neurology residents in clinical and technical EEG. I'm especially proud that I was selected to be the president of ASSET and OSET and the chairman of ABRET. And I also worked as the chairman of the Joint Commission on Education of EEG Technology. So I promoted schools in training.
Where do you see the industry in 10 years?
I suspect that it's going to remain very active, mostly in the field of epilepsy surgery, and perhaps in advances in monitoring within the ICUs. I just don't know that it will go anywhere else other than that.
What is the best piece of advice that you've ever received?
That I was advised not to take the ABRET exam because I wasn't ready to do it.
Is there anyone else in EEG that you think it would be beneficial for us to talk to?
I think if you could get, I don't know if he's still active at all, or not retired, but he'd be Dr. Irwin and his wife, Andrea Irwin, who's a technician. Dr. Richard Harner is a neurologist out of Philadelphia, and he worked with Theda Sanet. He was the first EEG technician who went on to become a neurologist, electroencephalographer, as far as I know. Theta Sanet is probably still in Philadelphia, and I guess that would be who I would recommend.
Okay. And what are the prominent electroencephalographers that should be documented?
Well, I think the Gibbses, both Erna and Frederick Gibbs, Herbert Jasper from Canada, Charles Henry, John Knott, Peter Kellaway, Eli Goldenson, Charles Riley, technician who's not involved at EEG anymore in Boston or in that area, Ellen and Albert Grass, and Ernst Niedermeyer, Sam Little. I think that's...
Okay, great. Well, thank you, George.